Assalamu alaikum wa rahmatullahi wa barakatuh. Our lecture today about the genetic disease that may affect maxilla and the mandible. اليوم إن شاء الله حنتناول مجموعة من الأمراض أغلبها genetic تتشابه فيما بينها histologically by the presence of multinucleated giant cells. لذا كي نفرق بينها we need for clinical radiographic and lab investigation in addition to histopatho. The first disorder is cheirovism. Cheirovism is a disorder characterized by abnormal bone tissue, in which the normal bone marrow is replaced by a cystic fibrous connective tissue. These growths give the cheek swollen, rounded appearance and interfere with the normal tooth development. Beginning in early childhood, diagnosed mostly between the age of 2 and 5, and the growth will continue till puberty, where most of cases cease and regress to normal size. Clinical features: painless bilateral symmetrical enlargement of posterior region of the affected bone because of a growth, facial deformity reported, and this growth results in impaired mastication, difficulty in speech, in addition to displacement of teeth, and as a result, malocclusion occur. In some cases, even resorption of the root, thinning and perforation of cortical plate. Premature loss of primary teeth and uneruption of permanent teeth reported in some cases. مرات, delay eruption of teeth in child is the main chief complaint that make families seek treatment in dental clinic, and as a result, the case diagnosed by thorough investigation, including clinical, radiographic, lab, and histopatho. The main cause for cheirovism is a mutation in the gene, about 80%, or 20% for unknown cause. Radiograph: bilateral multilocular radiolucency with the dental anomalies, but absence of periosteal reaction. Sometimes قلنا يسبب لنا displacement of the teeth and resorption of the roots. Lab test, no biochemical findings. Hyperbaric thyroidism test is negative, and this is important in differential diagnosis with the other disease or lesion. Histopatho: variable number of multinucleated giant cell in a vascular fibrous connective tissue. This multinucleated giant cell, small and aggregated focally. In some cases, eosinophilic perivascular cuffing of surrounding small capillaries seen, and this is considered a hallmark for the cheirovism. Otherwise, the histopatho or from histopatho, we cannot differentiate between these genetic diseases that may affect the jawbone and need for clinical, radiographic, and lab investigation. Treatment. The treatment, cheirovism, is a self-limited, require no treatment in most cases, just follow-up. لذلك, we have to wait until puberty because most of cases cease after puberty and the growth disappear. Otherwise, surgery is indicated for functional or aesthetic reason. شوكت only when the disease become quiescent. فقط متابعة للحالة في معظم الحالات لأن most of cases in which the growth disappear after the puberty. The second genetic disease that may affect maxilla and mandible is osteopetrosis. This is an opposite to osteoporosis. Osteoporosis هشاشة العظام. Osteopetrosis معناه the bone become dense, but both of them make the bone prone to fracture. المشكلة بالأوستيوبتروسيس بالأوستيوكلاست cell. There is inhibition in action of osteoclast. الأوستيوكلاست responsible for resorption of the bone. هاي الحالة فقط الأوستيوبلاست اللي هي مسؤولة for bone deposition راح تشتغل والنتيجة هو dense bone. This divided into frontal malignant, intermediate, and autosomal dominant. Then severity vary according to the pattern of the inheritance. In infantile malignant, where the cause autosomal recessive, most of the infant die within 2 to 3 years if not treated. هنالك intermediate or moderate case صحيح non-fatal are discovered by first decade, but this is else require treatment. And the autosomal dominant consider the mildest form of the osteopetrosis. Clinical feature, mild case, no problem. فقط follow up. Severe cases, the first complaint of patient is bone pain. Narrowing of foramen, this may cause blindness, deafness, facial paralysis. ليش؟ لأن تشكل ضغط على النيرف that passes through these foramen. And the bone susceptible to fracture, مرات even after minor extraction of the tooth. Dental problem, congenital missing teeth, and erection and malformed teeth, prognosis of the mandible, high caries index because of enamel hypoplasia, high risk for osteomyelitis as a result of diminished vascular supply in osteopetrotic bone. الراديوغراف طبعا depend on the subtype. This will determine the density of the bone. However, بصورة عامة appear as a dense bone. Treatment, total bone transplant, vitamin D, interferon gamma, and cortisone. طبعا الفيتامين D enhance the action of osteoclast. الcortisone induce resorption of the bone. Interferon gamma, this to enhance the immune system because affected by this disease, and erythropoietin for treatment of the anemia. لأن تعرفون البون مرة when become dense معناه اكو مشكلة وين بالريد بلاد سيل، مشكلة بالوايت بلاد سيل and a platelet. فهذه لازم ناخذها بنظر الاعتبار in any treatment for the case. Osteogenesis Imperfecta. Osteogenesis Imperfecta is a group of genetic disorder that mainly affect the bone. The term Osteogenesis Imperfecta means imperfect bone formation. People with this condition have bones that break or fracture easily, often from a mild trauma. طبعا هنالك أنواع عديدة. The main four type 2 and 3 تعتبر high mortality. The fracture occur in uterine. Type 2 have cases still born. إذن Osteogenesis Imperfecta genetic disorder make the bone more susceptible to fracture. المشكلة هو lack of collagen 1 as a result of mutation in gene because it is a genetic disease. There are 4 main types. Type 2 is the most severe. إذن عندنا type 1, 2, 3 and 4. Type 1 the least severe, 2 more severe, type 3 very severe, and type 4 moderate type. بصورة عامة the characteristic feature of type 1, the bone fragility more susceptible to fracture. Blue sclera اللي هي blue whites of the eye. This is the characteristic features of the type 1. Type 2, this is the lethal form. أغلب الكيسات die after short period of the labor, and sometimes during the intrauterine life, abortion occurred. Sometimes the fracture occur in the uterine life. Type 3. Multiple fracture. The bloods clear at birth but disappear later. Sometimes the fracture occurs before birth. Common. Type 3. The bone can even begin to break before birth. Bones break easily. And 4. This is considered the moderate type, but also increase bone fragility. In all these cases, the bone may fracture by minor trauma. Treatment. No cure. Just maintaining a healthy lifestyle by exercising and avoiding smoking can help to prevent the fracture. يعني البيشن لازم يتقيد بتصرفاته بحركته، يقلل طلعاته، ما يصعد أماكن مرتفعة، يتجنب الأماكن المزدحمة، لأن أي وقعة أي سقوط يعرضه to fracture. هذه في أحسن الأحوال. أيضا البيسفوسفونات this can increase the bone mass and reduce the bone pain and fracture. Cleidocranial dystosis. This condition primarily affects the development of the bone and teeth. Signs and symptoms of cleidocranial dysplasia can vary widely in severity. This is cleidocranial dystosis. The main cause, defect in RUNX2 gene, genetic in nature. Epidemiology, 1 لكل مليون. It is a congenital disorder, affect bone and teeth. Autosomal dominant trait, defect in gene for bone formation. The main characteristic feature, aplasia or hypoplasia of a clavicle. Clinical findings, loss of clavicles, عظم الترقوة يكون مفقود, short stature, large head, flat nose, hyperthyroidism, المسافة بين العينين, open skull suture and frontalis. The oral findings that associated with cleidocranial dystosis, prognathism of the mandible. This is due to a maxilla hypoplasia. يعني مو هو الماندبل small ولكن نتيجة إنه الماكسيلا hypoplasia the mandible become prognath. Supernumerary teeth. This results in failure eruption in a permanent teeth because of crowding of the teeth. Abnormality in cementum formation. Look to this radiograph. This crowding of the teeth as a result of supernumerary teeth will prevent normal eruption of a permanent teeth. Metabolic bone disease. Hyperparathyroidism. The parathyroid are small endocrine glands in the neck of the human. هي عبارة عن 4 parathyroid glands located on the back of the thyroid gland. These parathyroid glands produce and secrete parathyroid hormone in response to a low blood calcium, then regulate the percentage of calcium in the blood. They play a key role in regulating the amount of calcium and in the blood and within the bone. Overproduction of hyperparathyroid cause mobilization of the calcium from bone to blood, وبالتالي نسبة الكالسيوم بالبلد راح ترتفع. Hyperparathyroidism divided into primary, secondary, and hereditary. The primary hyperparathyroidism as a result of a tumor, whether benign as adenoma اللي هي أكثر الكيسات about 80% or malignant اللي consider rare. For example, adenocarcinoma. Primary hyperparathyroidism, there will be stimulation of osteoclast. This is responsible for resorption of the bone, cause mobilization of the calcium from the bone to the blood, and also decrease the calcium excretion in the kidney. Then play important role in regulation of calcium percentage in blood. Secondary hyperparathyroidism occurred as a result of vitamin D deficiency and chronic renal disease. In case of vitamin D deficiency, تعرفون vitamin D play important role in absorption of calcium from the gut, so there will be decrease in percentage of calcium in blood. This lead to more secretion of parathyroid hormone. This cause mobilization of calcium from the bone to blood. ولكن بالنتيجة the bone will be affected. أيضا secondary hyperparathyroidism is usually due to end-stage renal disease. There is renal loss of calcium, and with normal parathyroid gland, elevation of a parathyroid hormone occur in response to the hypocalcemia. يعني الشخص اللي عنده مشكلة وخاصة بالمراحل المتقدمة من الرينال فيلر راح يفقد more calcium، فنسبة الكالسيوم بالبلاد راح تقل، so there will be more secretion of a hyperparathyroidism. Brown tumor of hyperparathyroidism, these seen intraorally in some cases of a hyperparathyroidism. Then the brown tumor is a bone lesion that arises in a patient with a hyperparathyroidism, سواء in maxilla or in a mandible. Radiograph appear as a radiolucency in most cases because it is destructive. Histopathy. Resorption of a bone trabeculae, delicate fibrous connective tissue contain numerous multinucleated giant cells, accumulation of a hemosiderin and red blood cell. And this responsible for reddish brown color of the tissue and so-called brown tumor of a hyperparathyroidism. Then this hemorrhage responsible for a brown color of intraoral lesion that's called brown tumor of a hyperparathyroidism. ولكن هذا مو بكل الكيسات، في بعض الكيسات ممكن نشاهده. إذن the hallmark of parathyroid increase in osteoclastic activity with a bone resorption. Cortical and trabecular bone are lost and replaced by a loose connective tissue. Diagnosis: clinical radiograph histopatho, bone chemistry, there is elevation in a parathyroid hormone, in serum calcium, in alkaline phosphatase, and decrease in phosphorus. لذلك lab investigation is important in differential diagnosis to differentiate this case from other lesion or the genetic lesion that affect the bone and characterized histologically by the presence of multinucleated giant cell, because all of them are the same. Treatment طبعا أهم شيء هو treat the cause, whether primary or secondary. يعني إذا سبب المشكلة هو tumor أكيد surgery is indicated for the removal of the tumor, whether benign or the malignant. إذا المشكلة نقص فيتامين دي نعطي فيتامين دي supplement وهكذا. إذن أهم خطوة بالتريتمنت treat the cause. Now come to patched disease. Patched disease is a chronic bone disorder. There is excessive breakdown and regrowth of the bone. يعني continuous bone turnover. Because the bone regrow too quickly, they are bigger and softer than normal. هدم وبناء سريع للعظم. الكوز يا إما genetic, environmental factor, or viral factor implicated in some cases. Common on in Wise, it is rare in Asia and Africa. Risk factor, age, people older than 40 are most likely to develop patched disease of the bone. Gender, men are more commonly affected than women. Family history. If you have a close relative who have patched disease of bone, you are more likely to develop the condition. Then patched disease run in families. Other characteristic feature of patched disease, irregular bone resorption and deposition result in a large and weak bone, more susceptible to fracture. 80% are asymptomatic. Minority experience bone pain, secondary osteoarthritis, overgrowth of skull, bone deformity, headache, and neurological complication. Oral findings, maxilla more than the mandible, dentulous patient, space teeth. يعني مرات يجي البيشنت يشكي يقول فراغات جايه تصير بين اسناني. In edentulous, nowhere of denture. يعني هذه الحالة ممكن يصير بشخص dentulous or edentulous. الدنتulous patient يشكو or they complain from space teeth. الشخص اللي edentulous nowhere of the denture. يعني يقول هذا الدنشر اللي سويته قبل فترة وجيزة ما قام يقعد بالفك. بعد hypercementosis of teeth. شنو البروبلم that associated with the hypercementosis of the teeth? Difficulty in extraction. معناها fracture occurred during extraction of the teeth. Patched disease could be focal, affect only one bone, or multifocal, involve more than one bone. Radiograph, lytic phase, mixed or sclerotic phase. Hypercementosis and loss of lamina dura. ولكن the most characteristic feature of radiograph of a patched disease is a cotton wall appearance. إذن cotton wall appearance is a characteristic feature for the cotton wall appearance is a characteristic feature for a patient with a patched disease, ولكن not reported in all cases. إذن the radiographic appearance for a patient with a patched disease vary. Histopatho, highly vascular fibrous connective tissue, numerous multinucleated giant cells, mosaic appearance, basophilic reversal line. This indicates the junction between resorbed bone and a new formed bone, and this considered a hallmark for patched disease. The complication شنو? Fracture, deafness, cranial nerve disorder, and osteosarcoma. This is malignant. يعني ممكن يتحول بالمستقبل إلى الكانسر اللي هو الأوستيوساركوما اللي يعتبر هو primary cancer of the bone. Treatment not a cure, just control. Use bisphosphonate and calcitonin. The symptomatic patients are treated with bisphosphonate. Aim to reduce the bone turnover and promote healing of osteolytic lesion and improve the bone pain. Surgery sometimes is indicated. Central giant cell granuloma. It is uncommon, benign but locally aggressive and destructive osteolytic lesion of the jaw bone. Occur before the age of 30, more in female and in a mandible. Interior to molar and across the midline. The cause unknown. It is a destructive lesion, appear as a multilocular radiolucency in a radiograph. Then it is osteolytic, vary from small unilocular radiolucency to multilocular radiolucency and displacement of teeth with resorption. There are two types for central giant cell granuloma, non-aggressive and aggressive. In non-aggressive, it is small, no pain, no perforation of the bone. بينما الaggressive, characterized by rapid growth, highly destructive, associated with the pain and perforation of the cortical blade, and appear as a multilocular radiolucency in a radiograph. Histopatho, multinucleated giant cell in ovoid to spindle-shaped cellular fibrous connective tissue, background, extravasation of red blood cell and hemosiderin. Variable osteoid could be seen. Lab test, increase alkaline phosphatase. Treatment, surgery or calcitonin. Calcitonin is involved in helping to regulate the level of calcium and phosphate in the blood and inhibit the action of osteoclast. The last one is aneurysmal bone cyst, characterized by local destructive disease, a blood fault reactive lesion in the bone, but it is not a true neoplasm. Affect children. The cause, they are believed to grow in response to a disturbance of a blood vessel in the involved bone due to trauma, or they may grow because of a pre-existing tumor in half of all cases. This pre-existing tumor, like fibrous dysplasia or osteosarcoma. يعني شخص خاصة child have fibrous dysplasia or osteosarcoma and exposed to trauma may develop aneurysmal bone cyst. Clinical findings, teenagers mostly affect the posterior region and angle of the mandible. Symptoms vary from one child to another. Radiograph appear as a radiolucency. Histopatho, numerous blood-filled space, lack of endothelial cell lining, fibrous connective tissue trauma contain numerous multinucleated giant cells, thin strand of the bone. لاحظوا طلاب في كل هذه الكيسات histopathologically there is a multinucleated giant cell. لذلك لا نستطيع أن نفرق between these genetic diseases that affect maxillary and mandible from the histopatho alone. We need for clinical, radiographic, and lab investigation. Treatment, surgical curettage and partial resection, cryotherapy. High recurrence يعتبر high, sometimes reach to 50%. لذلك the follow-up is required. Thank you for listening.